Good morning, everybody. I welcome my brother here. This is a first. He never laughs at my jokes anyhow. So thank you for coming back for your second semester. I hope you had all good holidays. So we're going to start off with a pop quiz. True or false? Was there ever a trolley between Mamaroneck and White Plains? I need to. True it is. And God help us, they should have it today. Now, suppose it went to Tarrytown. Was that true as well? Yes. Yes, it went all the way to Tarrytown. Think of that. What is the age of the Boston Post Road? I'm going to go this. Late 1800s, anybody? Early 1800s? Late 1700s? Early 1700s? Actually, late 1600s. 1673, New York Governor Francis Lovelace dispatched the first postwriter to Boston. Which activist said the following? I like to be active in organizations, being it helps the community and it helps me. It is a means of expressing myself. Who said that? Nope. Hey, Liz, come on. Oh, you didn't say it? Oh, Jane said it. Okay. I'll give you a second hint. Who moved from the flats to Rye Neck and said, I guess it's on the other side of the tracks, but it's not a bad place, despite what you might hear about it? Keith Yeiser said that. Hey. What was the real name of Turtle Park? Jane. Well, of course, I was going to exclude elected officials, but I'll accept it. That's true. Vandenberg Park. What is the real name of Willow Park at the end of Oak Avenue? And thank you. Another elected official. Talking about repurposed buildings, the Christian Science Reading Room. What was that originally built for and its first occupant? Mamaroneck Federal Savings and Loan Association. How many elected officials are there, including our section in the town of Rye? Yeah, way too many. Includes school board. Somebody take a guess. Come on. 40 over here. Do I hear 40? Do I hear 45? Do I hear 45? 46, 46, 47? 45? 25. It's 55. It includes the library board as well. How many official harbors do we have? Official harbors. Somebody said 2. 3. No. 4. We have Larchmont Harbor, Horseshoe Harbor. Mamaroneck Harbor is really technically divided into 2. There's Mamaroneck Harbor, and the East Basin is Rye Neck Harbor. Where are the 2 most recent locations of the town court? Before its present court. Palmer and Weaver is one. Edgewood is the other, where the old police station was, near the firehouse. Here's a real local one, and I was just talking about this the other day. What was the Larchmont Village Gagliardi family famous for? Which judges? Joe? Nope. Joe Gagliardi was the mayor of Larchmont, became the district attorney of Westchester County, became a Supreme Court judge, and became the administrative judge of the 9th Judicial District. His brother Lee became a federal judge and retired as a federal judge to Vermont. And the father started a law firm, a famous law firm in White Plains called Clark Gagliardi. And he was the only guy I knew. They lived in a house on Larchmont Avenue between Palmer and Larchmont Post Road, where it had the lions in front. And he was the only guy I knew. He was an Italian immigrant, and he passed the bar by studying under an attorney. He left a lot of money to a library. And what other local politician left money to both libraries and instituted really a redo of their children's rooms? George Burchell. Yes, thank you very much. You know, get all these elected officials. Okay, I got three more. What was the original location of the Mamaroneck High School football field? What?
The original football field, you said, was right here at Richmond Road, but it was on Rockland Avenue.
Well, we do dispute it because I think it's where the garden apartments, Mamaroneck Garden Apartments are, where you come down the hill from the Pay Center. Okay. Which TV series is beginning its second 100 shows? There you go, the Local Live. Watch it this Thursday for the 101st show. And what organization used to have the name Hispanic Resource Center? What a segue!
Thank you, Jeff. Now I'm going to turn the program over to John Gitlitz.
Thanks. How many of you did not know that it was now called the Community Resource Center? It was an easy question. It's my pleasure today. You know, there have been a lot of changes in the last year in what is now the Community Resource Center. Not only do we have a new name, we have a new center, and we have a new executive director, and that's probably the most important change, who's brought with him energy and dynamism and has got us all very excited. Milan Bhatt came to us after a decade of working with the immigrant and worker population and working as a workers' rights advocate in New York and an attorney. He first worked with the New York Immigration Coalition and the executive director of the Workers' Rights Law Center, which doesn't exist anymore. He oversaw, excuse me while I read this and my glasses aren't good enough. He oversaw the provision of statewide legal services and led advocacy efforts in key areas impacting immigrant and other communities, such as wage theft, equal access to government institutions and identification, minimum wage reform, day labor issues, and the list goes on. He then served as co-executive director of the Worker Justice Center of New York in Kingston, Albany, and Rochester, overseeing advocacy, litigation, programmatic, and public relations efforts. In previous years, he had fellowships with Amnesty International's National Refugee Program and with the Executive Office of the United Nations Secretary General Kofi Annan. Currently, he serves as a board member of the New York Immigration Coalition, the Human Rights Committee in Mamaroneck, the Domestic Violence Council of Westchester, and in his spare time, he is the executive director of the Community Resource Center. He holds a degree in psychology from Columbia University and his Doctor of Law from the University of Iowa College of Law. He has been here for 6 months, and he's taken charge, and he's discovered about a wonderful community we are, and we have some very exciting new programs that he will be talking about. Milan. Actually, one more second.
Thank you, John. So I should clarify that the Workers' Rights Law Center didn't grow defunct. It actually grew into a statewide organization. Thank you for the really glowing bio. I feel humbled, as I felt when I got this invitation to sit here and have the opportunity to really talk about all the work that we're doing at the center and all the things that we want to continue to do. So I guess I wanted to start by saying, John mentioned the 6 months that I've had the pleasure of being at the helm of CRC and amongst all of you in Westchester, just how I remember at my first summit breakfast about 6 months ago, I didn't know anyone in the room. And it's just a real testament to everything this community has to offer that by now, just 6 months later, I feel I've worked with more than half of you in various capacities. I see here fellow board members of my organization, but I also see board members of the Human Rights Committee. I see so many other stakeholders. I see people who are so generous as to come and support us at my first annual gala, our first gala as CRC, and just so many other tremendous elected officials and government folks. So, I didn't know at the time whether it was a fluke, but now I see time and again just the way in which this community comes together to take on tough issues, and that really makes me confident in terms of all that we have in our collective horizon and all that we can do. I have always believed through everything I've done in partnership, a partnership approach, and that's not just rhetoric. It's something that I've tried to implement, and already I've just seen the real benefit. We are tremendously fortunate at Community Resource Center, as most of you know, to have a new building. It's not so new anymore. We still call it our new building, but to be able to have this stunning space, and I'm still learning so much about the history of the building as the former CAP Center and just the various incarnations and just kind of the tapestry of how so many people, so many leaders have been a part of that history, and so many of them are still around. And then on top of that, to have just the real opportunity to work so closely with Malcolm and Denise at their respective organizations, to have the Hunger Task Force and the Youth Center on site, because it really shows firsthand how just the various organizations that we have, how our clientele, our communities interweave, and how a holistic approach is really by far the smartest approach when we want to tackle some of the tougher issues that I'm going to be talking about today. So with that, I wanted to say a couple of words. John gave you some of my background, but for those of you who don't know me, and even those of you who I've worked with, just in terms of what inspires me and what is my vision, and none of it would be possible without the amazing staff. Our staff was not able to join us here today, but I do want to, a little bit later on in our remarks, and then we're going to have a Q&A, I do want to really highlight the various staff at the center who've been there much longer than I have. But just to take a step back, so John mentioned I'm a human rights attorney and an activist more than anything else. And when people ask me what was it in my career, in my background, that really made me realize that I want to be part of these efforts, it was back in 2002 when I had an opportunity as a volunteer. I was 21 years old and I was just traveling, and I found my way down to South Africa and had the opportunity to put together an HIV/AIDS awareness program. And at the time, in the province where I was working, volunteering, the incidence rate was 1 in 3. So 1 in every 3 individuals living in that province of South Africa had HIV or AIDS. And it's just one of those moments where, I've lived a pretty comfortable life and, had educational opportunities and been relatively healthy. But when you are confronted with a situation, wherever it is, whether in this country or abroad, where you actually see a community that's just dealing with such a dire issue, it's the type of thing where, especially the timing, as it were, right before law school, to me it was a lifelong mandate that everything I do in my career needs to somehow tie back to issues that are that dire, that really affect issues around survival and subsistence and education. And so I always harken back to that. And, with that background and with that motivation, about 6 months ago, I had the opportunity to, be a consultant for my predecessor, Zoe Cologne, who many of you know. It didn't take long for me to realize that at the time, the Hispanic Resource Center was a very unique organization. The types of challenges which I'm going to enumerate are, I don't want to keep using the word dire, but I want everyone at the very least today to get a sense of the reality that our communities are facing and how serious, whether it's in the educational context or healthcare or housing, the challenges really run the gamut. And we are so blessed to have so many resources in this community. And I'll be very direct, so much wealth in this community. And it's amazing to see how many people are really willing to roll up their sleeves. And to me, a few weeks ago, around the holidays, it really kind of highlighted what we have when several of you, religious leaders and other centers, came to meet with me and to say, how can we help with your holiday drives? How can we make sure that your clients have presents and coats and just the basic necessities? And that showed that it's really walking the walk. It's not just writing a check. It's not just putting your name on letterhead. But people here are really concerned about these issues. So I just want to acknowledge that. So we have our work cut out for us. And what I wanted to do was kind of, have two parts to my remarks. One is, what are those challenges that we're facing every day? And two, what is it that our center is doing to try to respond to some of those challenges? So, as many of you know, so we're the Community Resource Center now. And there was a lot of discourse that went into the decision of changing our name. And so I wanted to just say a couple of words about that. So as the name suggests, and as the history of our building suggests, one of our biggest priorities as we tackle some of these challenges is to make sure we are doing everything we can to open our arms to the entire community. We have a mission that we've been in existence for 18 years, and our mission continues to be to focus our efforts on the new immigrant community, because a lot of those challenges that we're seeing that I'm going to be discussing are unique to those communities. But we also know, and I've mentioned this a few times in my first few months, we know empirically and we know anecdotally that these challenges facing new immigrant communities are challenges that faced immigrant communities generations and generations ago, when other immigrant populations were starting to occupy Mamaroneck back in the 1920s and 30s. We also know these are challenges that are facing non-immigrant communities. These are challenges facing African American communities. And so it's just really important that everyone understands the real thrust behind our new name is to make sure that we're doing everything we can to serve the broader community. That being said, some of these real challenges that I'm enumerating do take a particular toll on new immigrant communities. So there's 10 challenges that I've identified, and I'm going to go through these fairly quickly. I want to make sure we have a chance for interaction and for me to explain what it is that we're doing and what we'd like to be doing more of. So the first one is language access. This is especially for newer immigrant communities. Now, one of the programs that I'm going to describe that we offer is ESL. So and not just us, BOCES, a lot of our partners, so we know that every single one of these programs around making sure that everyone speaks English has a waiting list. And so what we're seeing is there's a real will to adapt, to learn English, but at the same time, the resources are just not there. So in that interim phase, unfortunately, a lot of immigrant communities that are still in the process of acquiring English competency are facing barriers. Everything from the school system, where they can't read the report cards that their children are coming home with, or various government agencies where they need to be able to communicate. And unfortunately, despite amazing leadership from Albany, I know that there was an amazing executive order that passed a few years ago, but still there's work to be done to implement that. So just number one, these are not in any particular order. So the first challenge, language access. 2 is isolation. So I think this is something that we see just socioeconomically in any locale. It's not just an immigrant issue, but just the isolation factor where you're having, and especially when you were talking about newer arrivals, the phenomenon is that people will tend to gravitate to what they know, to their comfort level. And so in a way, it just makes our work harder because a lot of our communities just face social isolation, economic isolation, cultural isolation. And we know the reasons for that, but it is something that ends up kind of working against the interests of communities when they end up kind of pigeonholed and pocketed in certain parts of the community. 3 is just huge, very significant, economic security. So as I'll describe, a major pillar of our organization is our worker center, where we do what we can to try to improve the economic security through the workers' rights lens. But to be sure, economic security is something that goes well beyond the workplace. It's something that is just, it goes to the life and death survival type issues that I was describing. And it's a major part of our mission is to really combat poverty in all of its forms. 4 is affordable housing. So, and I want to provide some anecdotes, keeping in mind the confidentiality that we have with our clients. But, I'll just mention now that, we had a situation, as folks know, the A&P closed here. And so the food options, the grocery options, are a real issue, a real challenge right now, especially right now, for our communities. And adjacent to the grocery store, to the A&P, was a housing building, and as it turns out, pretty much every single one of the tenants were given a sum of money and asked to leave within a few months. And so the problem is, when these individuals are displaced, and I'm going to try not to be political here today. I'm not, there's issues that we touch on that can be controversial. That's not why I'm here today. I'm just here to talk about the reality and what we're doing to face it. So that just there could not be a better example when I talk about a lack of affordable housing and how it affects our communities. Is that situation where these tenants come to our door, and unfortunately there isn't that much that we can do. But we do what we can to try to work with brokers and to try to find affordable housing. But in reality, if the affordable housing isn't there or isn't there in enough abundance, we kind of run into a dead end. Number 5 is transportation. So not to put Valerie on the spot, but I saw Valerie there from the Mamaroneck School District. I want to acknowledge, I talked about partnership, but as I go through talking about, challenges and initiatives, I do want to give credit to people who we're working with. And so one of the projects that I'm really excited about, we've had a partnership with the Mamaroneck School District for some time. I was approached by the superintendent and various faculty several months ago from the Mamaroneck School District, and one initiative that's really been very successful already is the development of a survey. And we've had a lot of the AP students and just really well-achieving students from the district come to our center, work with us, hear about our issues, and the result is a very comprehensive transportation needs assessment survey that's been developed, and we're starting to implement them. And really, we suspect it's going to confirm something that we already know, which is that this is one of the major challenges facing the demographic that we serve: lack of transportation access. And just to go a little bit further, so and this gets a little controversial, but one of the campaigns that I was involved with helping to lead years ago was around opening up our driver's license policy. Whatever people's take is on that issue, the reality is that a lot of our communities do not have driver's licenses. And part of the reason is, again, relates back to poverty. We take for granted being able to afford a car, but just imagine, especially in winter months, especially when some of those grocery options are taken away, what do our communities do if they can't afford a car and they need to go grocery shopping? What do they do when they need to go to seek medical care, which is another issue I'm going to get to? What do people do when they just need to take their children to a soccer game, or just the basic things we take for granted? So it's not just not having a car, but also oftentimes, and this comes up mainly through our worker center, when we place workers with certain employers, contractors, subcontractors, what have you, it often ends up being outside of Mamaroneck. And so there's a reliance on public transportation, but the train routes are limited. When you talk about the Metro North, you're talking about a very specific linear trajectory, and the reality is a lot of our clients need to be able to access legal services or employment in places where the train and oftentimes the bus can't even reach, or the commute time ends up being so much because the route is so circuitous that it just doesn't work with their employment framework. So again, transportation, there are a lot of layers there. I just wanted to put that out there. Number 6, and this is huge, worker exploitation. So, again, this is not an issue that, I think it's an issue when I talk about workers' rights that can hit close to home, because many of us are employers in some form or another. We have domestic workers, or we've had people who are contractors. So these employer-employee relationships, or even contractor relationships, exist just everywhere. So in a few minutes, I'm going to talk in some more depth about what our response is. But again, I just wanted to say that when I talk about worker exploitation, it's not necessarily something that's always a situation where an employer is trying to deliberately exploit the workforce. Oftentimes they just don't know the law, but the reality is workers are not being paid in many instances tantamount to the work that they've performed, oftentimes in violation of employment contracts, et cetera, and that's a real issue. Number 7, so just lack of benefits. Again, I won't say too much here, but people have varying, I don't want to talk about immigration status, but There are people who are in the process of adjusting, people who've waited in line, people who are doing what they can do, but because they have not acquired a full citizenship status, they often are not eligible for certain benefits. And again, when the rubber hits the road and you're talking about being laid off, or you're talking about some of these other challenges, it doesn't make things easier when one of the common routes you can go, which is for government assistance, is not eligible. And again, that could be unemployment insurance, it could be DSS services, et cetera. So there's kind of a fundamental barrier there that we understand, and we have to work around. Number 8, and this is kind of more amorphous, but just the general lack of acceptance and at times prejudices and discrimination. I mean, this is not to, I was a psychology major, not to get into human nature, but the reality is that we all accept the proposition that people tend to gravitate more to what they know, and people tend to fear more what they might not know, and that goes to that also goes for demographical issues. And so when we talked about the isolation earlier, sometimes it could be more tacit, but there are situations where parts of our community might not feel welcome, and especially parts of our community that don't have the opportunities to interact with everyone else. It ends up being just a situation where people feel further isolated and then further recoil into their enclaves, and that's not something that's healthy or good. So I guess a couple more challenges, and again, there's so many more, but these are just meant to give a flavor of what we see every day. Issues around health. So statistics show that certain populations, including Latino populations, African American populations, for various reasons end up being disproportionately more likely to acquire diabetes or other forms of health issues, heart issues, other things like that. And it's no surprise. It's a quality of life issue. It's a issue that relates back to the lack of healthy food options. And there's a myriad of reasons why, when you talk about populations that are isolated, that are dealing with these really stressful realities, right? So, I mean, I don't talk about stress directly, but you can imagine just the mind-body connection. When you're dealing with people who are being exploited, you're dealing with people who are isolated, who can't access benefits, et cetera, et cetera, et cetera. Aside from the external reality there's an internal psychological reality that doesn't make it easier to live a healthy life. And oftentimes there's forms of abuse, alcohol abuse, drug abuse, which makes things really, really serious. And so I just would lump all of that into just one of my 10 challenges. And, just the final one on this particular list to really emphasize is access to financial institutions. So, and this is an issue that does affect new immigrant populations more than others. So the Patriot Act, over 10 years ago now, basically set a lot of stipulations in terms of what banks, must do in terms of basic transactions to verify identification, et cetera. It's always been the position of advocates. It's pretty plain, actually, that banks, even under the Patriot Act, have the leeway to accept what are called ITINs. Do people know what ITINs are? Does anyone know? John, do you want to? He's eating. I'll say. So it stands for Individual Tax Identification Numbers. There are millions and millions and millions of these issued. So for people who want to pay their taxes, but for whatever reason might not be eligible for a Social Security number, they go to the IRS. They're given, an 8-digit number, and it's meant to be a substitute or surrogate for a Social Security number. These are entirely lawful, IRS issued numbers that are given to individuals, and they could then report them on tax forms. They can continue to pay taxes. People might say, well, why would they pay taxes? Well, if for no other reason, if not out of civic obligation or anything else, by creating that paper trail that you're paying taxes, if and when the federal government does decide to reform our immigration laws and have some sort of system, whether it's legalization or path to citizenship, whatever you want to call it, if and when we're at that point in time, one of the fundamental requirements, now there would be no amnesty, right? This is something where people have to apply and they have to show they met certain really stringent requirements. One of them is you need to show a paper trail that you're actually paying taxes. So there is that self-beneficial reason why even immigrant communities would have to pay taxes. Now, of course, everyone pays sales tax. So when people say, oh, some group doesn't pay taxes, everyone pays sales tax. And in addition to that, this is a way that anyone can also pay income tax if they choose. So those are kind of ongoing challenges. I just wanted to flag before I talk about the way our programs respond. And John, if I'm not okay on time at any point, just let me know. I want to make sure that we have enough time for Q&A. So oftentimes there are special challenges that we face. I'm not going to go through a list there, but I just want to give an example. And again, one of the points I wanted to just, it's a statistic is people are curious, who do we serve? Who actually do we serve statistically? So I went to our case management department the other day, and I wasn't surprised, but I did get a breakdown. So the most common population in terms of our clientele is individuals from Guatemala. Second is El Salvador. 3 is Mexico, Honduras. And then we're seeing more and more non-immigrant clients, Jamaican clients, African-American clients, Caucasian clients, et cetera, et cetera. So we think that it's working. The name change is signaling to people that we are an open door, that we have our doors open. I think it's already paying dividends as we're seeing more and more diversity in terms of who's coming to our center. But that's what the data shows. That's who we're serving. So some of you might know that about 10 days ago, there was a directive from Homeland Security, a federal directive, of course, that basically said that the administration for the foreseeable future is going to prioritize the detention and deportation of a certain group of individuals. Who are these individuals? They're individuals who have their roots, their country of origin in certain Central American countries, and who have arrived in this country after May 2014, and who have a pending deportation order. So that's fairly narrow. Now, 2 things. One is because of the fact that these countries of origin I just listed, they dovetail just 100% with who we serve. And so there's been a huge fear and chaos factor, people who have nothing to worry about because they don't, the third component of what I described under that prioritization, that mandate was key. People against whom there is a deportation order. So that means people who are not supposed to be here, people who have been ordered deported. But what we're seeing is that families who are citizens or who have green cards or don't have any deportation order against them, people who have a right to be here, don't understand that nuance. They don't understand that there's such a narrow application of this policy. And second, that New York, and we've had conversations with the regional leadership of DHS here, of ICE here in New York, and they have quelled a lot of those anxieties. Not to say that immigration isn't continuing to do their regular course of business, but they have not. That directive has not been focused on New York, and so what we're seeing in states like Texas and Alabama and other states, fortunately, it has not been implemented in New York. But nevertheless, that is a mandate for us because every time, and now with social media, with Facebook and everything, it's amazing. It's a blessing and a curse. It's a blessing because when we have good information that we want to get out there, and that's a huge part of what we do, is know your rights. Through all of these different contexts I'm talking about, we want to make sure that we're getting really sound and accurate information out to our communities. But it's a curse because once you have misinformation and mythology that's circulating, that spreads like wildfire as well. And that makes our job more difficult because it's not just the reality that we need to respond to, it's also the misinformation that we need to debunk. So with that, I just wanted to kind of move on. People might have questions about those challenges, but I think I should move into some of our responses, and then we can kind of do the Q&A. So we have 3 main pillars at CRC. Our case management department, through which we conduct direct services, our worker center, which I mentioned a few times, and our educational programs. And so I used the word holistic before. I think this just kind of institutionally reflects, it's by no coincidence that we have these 3 pillars because we recognize that the situations facing our clients and their families, really it's families that we're serving. Oftentimes there'll be an individual, maybe a worker, a young man, a day laborer, but then we find that maybe his wife needs our assistance, or maybe his children need our educational programs, or happen to be enrolled in the Head Start program that we house as well. So we're seeing more and more that the services that we're providing and the programs affect entire families. So just a little bit of detail about those 3 pillars, and I'll start with our direct services. So we offer a wide range of services, and we talk about human and social services, and this encompasses everything from really simple interventions. Someone might need a document translated, someone might need a notary, and then it goes more and more complex, where we might need to assist someone with their food stamp application or some other public benefits if they're eligible. I'm really proud to announce an accomplishment that has been years in the works, but we recently learned that our application for what's called BIA accreditation, I'll explain what that is, to the federal government was approved last month, which means we now can provide immigration legal services. BIA stands for the Board of Immigration Appeals, and oftentimes, one of the things that we have to fight is the so-called notario effect. A notario is basically an unscrupulous immigration attorney or a non-attorney who's pretending to be an immigration attorney. You see, what happens is with all these challenges, it creates a susceptibility to our communities. And unfortunately, one of the biggest culprits that prey on that vulnerability is people who offer immigration services. They'll say, oh, well, I can get you a green card. And they're, again, they might not even be an attorney. They certainly don't have the competence. So by seeking and now actually achieving the BIA accreditation, it means the federal government has looked at our credentials, our history, our expertise, and said we are now authorized to be able to provide those services, which is great. It also creates potential revenue for the organization, which our board is excited about, but really it's not about the revenue. It's, it all matters, but it's to make sure that we are really open, that, we are qualified and accredited. And so that's huge. I mean, with that, we're going to see more and more people coming forward to be able to, because you know what it is? It's not always black or white. People have status or they don't have status. Oftentimes, immigration law is complex, and so you have people who might have viable asylum claims if they're escaping gang violence back home, or maybe they have the right to petition for a sibling or some other family member. So we're seeing more and more of these applications, and so that's a huge part of what our services cover. Thank you. So there are many things that, so even in terms of legal services, despite having the accreditation, we're going to continue to work in partnership, right? And so some of our key partners are legal service partners. We work with PACE and other private and public immigration attorneys to make sure that we can bring attorneys into our center. See, this is our philosophy. We have 10 staff, and we have about 10 to 12 board members, but we have over 20 volunteers and interns, and then we have our partners, and we have their volunteers. So in a way, I think by virtue of that snowballing effect of everything, which is why we really believe in partnership, we're able to have a lot more clout and power and impact than we would be if we worked in isolation. So our partners continue to be key. Oftentimes, there are referrals that we just can't handle everything in-house. Taxes, we don't do taxes. So we have sources, clinics that we go. We can offer those services out of house and various others. So I wanted to, and so one of the, many of you were at our gala, and I had a chance to talk a little bit about our domestic violence program. And then we got to hear a real human story, and I think there wasn't a dry set of eyes in the room at the club. When we heard from the daughter, who was accompanied by her family, and a mother who we served, when we talk about success stories, it doesn't really get any more poignant than this. And I'm not going to kind of repeat all the details, and there's some confidentiality, but basically a major part of our direct services or case management is domestic violence intervention. So over the years, and so we've had a major federal grant with the U.S. Department of Justice. We're seeking other sources. All of you have been so supportive. We met our goal that night, and we're able to continue with that great work. But the story of Hannah and her family, I think, really just tell the story of what we can do. And so here in this situation, you had a mother who was the victim of serious, not just verbal, but serious physical violence at home. And we were able to intervene. Over time, over the years, we've had a bilingual therapist. We're looking to continue to have that in some form, because that's, mental health. You talk about physical health, mental health. I mean, these are equally important issues, but I feel that in our society, we could still do more in terms of resources for healthcare, but we could do much, much more in terms of mental health resources. And so for people who might not speak English, it's really important that we have more resources, therapy and other sort of mental counseling for people who are victims. So we have been able to meet some of those needs. And Hannah, this beautiful young lady, got up there with such poise and empowerment to be able to say, this is what my mother went through. But she was also able to access her educational programs, and now is on her path to a great career. So we like these success stories. And that brings me to the second pillar, our educational programs. I don't think anyone in this room would dispute just how fundamental the educational opportunities are. You could do whatever you can, whatever we try with our services to intervene, but oftentimes these are Band-Aid solutions where we're responding, but we know that there's a real deep-seatedness to this problem that we need to address, and a huge part of that solution is to make sure that from a very early age, young people are able to supplement. Maybe they're not getting all of the attention they need within the school district, although we have great respect and admiration for everything that the school district has done, but we try to supplement that and also create new programs. For instance, we're really proud of our civic engagement program, civic leadership rather, and we've had it for several years now. We work closely with the Eileen Fisher Leadership Institute, and it's gone a long way towards allowing young people, this is high school age, we do one for middle school as well during the summer, and there's plenty of room for enrollment. So when we talk about issues like co-op and we can't do everything, we're a small organization, but we do take that seriously. We want to make sure we reduce the number of gaps, whether those are substantive gaps or temporal gaps, to make sure that every child has ample resources and ample attention paid. And so just to mention some of our programs, so the Civic Engagement Program, we also have Mommy and Me, which is great because you have mothers, first-time mothers, who are able to come and bring their young people and learn in terms of parenting skills and all of that great stuff. Adult literacy. The reality is that in addition to ESL, I mentioned earlier, that's a huge program, but we also realize that it's not just English language. Oftentimes you have situations where people just don't have literacy at all. And so we have a special set of programs that tailor those specific needs. We also have GED and SAT prep that we're proud of. And so every year our docket of programs change. We're really open to feedback, and I really mean that because there's so many great ideas. And that's what I like about this summit. I'm learning. We were talking earlier about just the diversity, the representation of this body. So I can make a personal commitment to all of you. If there are ever programs that you feel, it could be anything, just let us know and we'll find a way to make it work. The final pillar of our organization is our Worker Center. And now I want to start with a pop quiz. I won't have as many questions as my colleague, but I want to put this out to everyone. And you don't have to really use your pen or anything, but just to show, this is a very educated and well-off group, okay? So I would imagine that some of you might get this answer, would be able to answer correctly. So my question is, let's say you have a worker. It could be a nanny, a domestic worker, a construction worker, anyone, right? You have a worker in your home, at your workplace. Under our current law in New York, if the worker performs 50 hours of work a week, what is the minimum you need to pay that worker? 50 hours. It should be a very simple question. Many of you are employers, you have workers. What's that bottom line? Now, we think it should be more, but let's say, what is that threshold, that legal threshold of what's the minimum for that work week? 50 hours. Yes, Ruth? So I'm looking for a total for the whole week. There's only one right answer. I'll give it a minute. If anyone has an answer, wants to take a stab at it, just raise your hand. Someone's on the right track, I can overhear. Does someone want to take a stab? Oh, well, very close. It's actually it's 495. But does someone want to say how they got to that? It's a simple calculation. I heard it. I overheard it there. How do we get to that 500?
I figured $10 an hour, give and take.
Okay, so I'll just say it. You're very close. So the answer is 495, and this is very simple. The minimum wage in New York State is $9 an hour. Everyone gets the concept, right? There's a minimum wage. It used to be $5.15. It's gone up, thankfully, in the years. That's something I fought for. We're at $9 an hour. There are exceptions for young people at school summer camps, things like that. But generally speaking, those examples I gave, $9 an hour. Any hour worked over 40 is overtime, and that means it's not the regular rate of 9, it's time and a half. So that's in this situation $13.50. So it's 9 times 40 plus $13.50 times 10. So that's how we get to 495. So even just I wanted to provide that example. I'll tell you why. Because we're not out to just have some draconian, litigious approach towards resolving these issues. We understand that oftentimes employers in any industry just don't know the law. Sometimes it's complex, and the minimum wage is changing, and just these calculations, we don't necessarily expect everyone to know. So I really want to make that point, because that being said, we do take these issues seriously. So in terms of our worker center, there's really two main things that we're doing. One of them is, well, three main things. One of them is workforce development. We know what the low-wage industries are. We're talking about construction, day labor, restaurants, right? There's about 15, they're called unregulated industries or underregulated, which means that non-compliance tends to be very prevalent. And the result is that for whatever reason, workers are more likely in these industries to go home with less than they actually are entitled to pay. So this is like black and white, like law school 101. This is a contract. This is simple stuff. So, but the reality is that the level of violations are so rampant. In fact, I can tell you just along Mamaroneck Avenue, I'm not going to mention any names today of establishments, but there are between 15 and 24 establishments just along Mamaroneck Avenue against which we have credible reports from workers that these establishments are engaged in some form of wage theft. So this phrase wage theft, it's growing in terms of significance. A woman named Kim Bobo from the Interfaith Worker Center, a national organization, wrote a great book called Wage Theft in America. I highly recommend it. And since then, this concept of wage theft, and the reason I keep saying this phrase wage theft is because I want people to understand that whether or not, like any criminal law, not knowing is not an adequate defense. So in New York State, wage theft is a misdemeanor. In Connecticut, it's a felony. You can go to jail. But I say this just to kind of give people a sense that these are, just to show the seriousness of it. The reality is that these are treated largely as civil issues. And when we get involved, our approach is to negotiate. Sometimes, the worker comes to us and says, I wasn't paid this amount. Our first approach is to pick up the phone, to talk to the employer, and say, look, let's work this out. And oftentimes that's enough. And what we've done there is we've made the worker whole, but we have also provided basic information to the employer so they know next time, they'll get it right. So workforce development, right, I talked about these industries. We use out-of-house trainers to come and to provide comprehensive trainings, construction trainings, restaurant trainings. I mean, talk about success stories. We had 100-hour restaurant certification training, and we're going to continue it now. And the folks at St. Thomas Church have been so kind as to open up their kitchen, and we're going to be replicating this. But we had one a couple of years ago, and as a result, we actually produced several individuals who became chefs, well-known chefs in the area. And I mean, that's a real success story, right? Just to show how you connect the dots. Someone is lacking the skills they need. We provide a program, and then a few years down the line, they're actually able to not just make minimum wage, but to have a pretty good job. So I'm going to move to the end of just a couple more minutes, if I may, John. So that's the worker center. And again, so we do file claims, not just for unpaid wages, also unemployment insurance for people who might not be able to navigate the system. And then most importantly, we actually match, we look at the demand for certain jobs, and we will actually, we're not a job agency, but we will do everything we can to allow clients, potential clients, workers, to be able to avail themselves of jobs that are available. And so with that, I say to all of you, if anyone actually has a need for a worker, let us know, because really it's not, we're not going to create hoops to jump through. We're just going to know that if one of you approaches us and, you know, we give a basic explanation of what the contract would be, you sign up, and it's better that way. Otherwise, we often send workers out into the abyss, and that's something we try to avoid. So what I'm not going to have time to get into too much is, you know, just to go back 20 minutes, 30 minutes, I was talking about human rights issues. You know, something I've seen, and I'll say I've seen it more in other parts of the state. As John mentioned, I've kind of been around New York State working on some of these issues, but I can tell you that they exist in Westchester as well, and that's human trafficking. Many of you see on the Law and Order and some of the shows, you hear about human trafficking. We think it's kind of some remote, esoteric issue, but I can tell you firsthand, I guarantee you, that as we sit here today, there are women and men being trafficked here in Westchester, and it's just something we need to be thinking about. So thankfully, we do have ways to intervene. We work with the federal government, with the FBI, through partner organizations. It's not happening everywhere, but it's the type of thing where it shouldn't happen anywhere, and we just need to be mindful of that. And usually it's either sex trafficking or labor trafficking, and it ends up being very complex. Thankfully, we have the legal tools in New York State and federally to be able to respond, not just criminally, but to actually have civil remedies for these unfortunate victims of human trafficking. So I mentioned some of the victories that we've had. You know, others. There was a worker last year named Roberto. He was working as just a subcontractor and was not given ample instructions. He didn't know there was some malfunctioning with the equipment, and he was using a lawnmower, and his fingers were severed. We were able to file a successful workers' comp claim and also recover his wages. That's just one example. His name actually was Roberto, but I wanted to at least give some. I can't always give the full names and everything, but I just wanted to provide a personal touch there. And, you know, sometimes we are activists in part. You know, there's so much more that we do, but sometimes we realize that the best way to raise awareness is through some form of a protest, even if it's a very silent protest. And we had one of those. I'm not going to mention the establishment last year, but the beauty there is we get to not just provide basic services, but some political education to our people so they know that if their voices are not heard, that there's a way for their voices to be able to stand up for themselves and to speak their mind, and that our First Amendment allows them to do that. So, you know, I think just the last couple of words I'll say in terms of new initiatives that we have. We're proud to announce that we just learned a couple months ago, the Department of State here in New York, Governor Cuomo, a few years ago created what's called the Office of New Americans. There are 2 official opportunity centers in New York State, and we ended up applying, and we were successful. So we are in partnership one of those 2 official centers, which is exciting. It means that we get a grant from the state, but also that we have all their resources, that there's an obligation now the state has to work with us to provide resources. Also, we entered into partnership with the National Domestic Worker Alliance. This is specifically to help educate domestic workers who oftentimes are amongst the most isolated of the workforce and don't have the solidarity of having co-workers and things like that. So just to work. A health initiative, I mentioned some of the health challenges earlier. We are just starting to work with the RIY to be able to address diabetes and some of those health issues by preventative workshops to really allow people to learn what their healthy food options are. And there's a cultural awareness. Sometimes in certain cultures there are foods that just people don't know that they're healthy options even within that cultural space, and so to help kind of educate. You know, there's a few others, but I didn't want to go over. The final thing I said, just what can you all do? So I think just even sitting here and engaging and spreading the word, I mean, I don't want to be too minimalistic, but there's great value in that. We're a small enough community that if everyone just commits to sharing some of this with 5 of their friends, you know, even if it's over wine and cheese, just having opportunities to increase awareness, to have these debates and dialogues, writing op-eds. There are tough issues that we've been working on. locally, like the open door and the co-op, and whatever it is. My colleagues at the Human Rights Committee, I hope that we all can also figure out ways to work with my center and also to just encourage more and more socially conscious and progressive people to not just talk and think, but to write and to submit articles and op-eds, and then just to be responsible consumers. I talked about these forms of exploitation. We have great power, all of us, to be able to just give a little nudge in the right direction and just think to make choices in our daily life. So if we know that there's going to be a workplace, a restaurant that's not being scrupulous, maybe we say, hey, you guys need to comply, or we're not gonna eat there anymore. And then just keeping your eyes and ears open. So with that, again, just thank you. Let's keep the partnerships going. Let's keep the information flowing, but only like the good information, not the bad information. And my door is always open. And thank you so much for listening.
We only have a couple of minutes for questioning, so I'm not going to give you an exam to see how much of all of that you kept in your heads. There's an awful lot that the CRC is doing. Let's take questions. Just give them to me from your seat. I will repeat them for the television and then turn the microphone to Milan. Elizabeth.
In many cases where local laws to protect people clash with desperate needs, and the classic example is a housing code and people who desperately need to be living somewhere, even if it's substandard housing. How do you deal with those issues?
The question was, there are many instances in which local housing codes may clash with the needs of people who end up in substandard housing because they can't afford. And Elizabeth asked how we are handling those cases.
Thanks, Elizabeth. I want to make sure I fully understood the question, but I mean, we do take a pro-compliance approach towards issues. So if there are, but also there's no one size that fits all. I mean, if we're talking about minor code infractions, sometimes, in the end, in this situation, if we're talking about tenants or potential tenants, our approach is to let them know what their options are. And so to say, look, if you want to go to local court and raise these housing issues, you can. But these are the potential risks as well. So I think there's like a micro level and a macro. I mean, on a macro level, we want to make sure that there's just sufficient allocation of affordable housing units, so people aren't pitted in these situations. And oftentimes, again, we will take a negotiator approach where if there are things that the landlord can clear up, we'd rather take that approach instead of having to encourage, lengthy legal battles. So I don't know if that answers. There is a clash. That's right.
Any other questions?
Are there any initiatives that are either before local town boards or councils where you'd like to have before town boards and councils?
The question was if there are any initiatives before local boards or town councils that we think are important, or are there any initiatives that we would like to see before local boards or town councils?
No, I mean, I think that's something that we're developing to actually have a local agenda. I think it's actually, in some instances, more evident at the state level, some of the issues that we know can trickle down. I mentioned language access, minimum wage, although I will say that there is local authority to be able to pass wage ordinances, and a lot of towns like Yonkers and a lot of cities and towns around the state have kind of gone in that direction just to go a little bit further, even if it only protects a subset of workers. So I think there's more around wage issues that can be done. And just, I wouldn't downplay, I shouldn't even use the word symbolic resolutions or proclamations, but sometimes when you have issues, whether or not the jurisdiction is with the local level or the state level or joint jurisdiction, if there's an issue of significance, we'd like to know we're able to go to local councils and boards to be able to say, let's pass a proclamation, or let's urge New York State to do something, or let's urge, sister municipalities to do something. So, there are some issues before the school board. I mentioned a couple of them earlier. I think those seem to be real priority issues. I mean, we want to make sure that there's, and feel free, John, to add as a board member.
No, is the school board meeting tonight? Yes.
So I'll pass it over to.
There's co-op, the standards, co-op camp and open door that are very very controversial.
I'm Melanie Gray. I'm one of the school board members, and tonight our meeting, we will be discussing Sorry. Our meeting tonight, we will be discussing co-op camp. We're not discussing school-based health center tonight. That's a couple weeks out, but we are discussing co-op camp tonight, and we welcome input, and particularly in advance. We want to hear from everybody, but there's a limited amount of time, and we are always open to any written comment.
Thank you.
Thank you.
Malcolm.
That was a good segue to the question I had. You mentioned healthcare as being one of your issues that you give a lot of attention to, and open doors proposal to create a school-based health center has been referred to. And you also referred to inherent community biases. Is there any effort by the Community Resource Center to create some kind of outreach to the community as a whole to try to overcome some of those obstacles to possibly lead the way to getting a school-based health center into American campus?
Okay, let me see if I can summarize that really succinctly, as it was a very sophisticated and complex question. Milan alluded to community biases and community prejudices and how they affect issues, and he alluded to some of the issues that are before us, amongst them open door. And he asked if there were any initiatives on the part of the Community Resource Center to try to address some of these biases. Is that a...
Thanks, Malcolm, for the question, and John for summarizing. So, again, not to beat the drum of partnership, but on that issue, I think what we're the framework right now. Just to acknowledge again the Human Rights Committee, I think as CRC being a representative through me of the Human Rights Committee, what we have done is come up with a comprehensive strategy which includes community engagement, and I think that would be a huge part of our role. But I think just even factually, I think there's been some, and not to go too far of a dive into it now, but just some misunderstanding around the actual clinic that's going to be opening on Mamaroneck Avenue, the time frame, how that affects. I mean, our position, I'll be very honest, the position of the Human Rights Committee and of CRC is that there's a very unique need that the school-based model provides. We've been really pleased to see the evidence out of Portchester and Ossining and others. It's really seems to me almost like a no-brainer, because you're talking about a low-cost, or in fact, no-cost issue that we look at that data, and rather than continue to, assessment is good, we do it in every form, but I think when we know something has been tried and tested, and we know that we're talking about an issue that's going to decrease absenteeism, and that's actually going to provide an option, a very modest option, but one that could be really helpful to make sure that kids receive the care. I mean, I think a lot of the people in the room might be on the same side of the issue, but we do need a kind of a grassroots response, but I think it needs to feed into an overall comprehensive, multi-pronged strategy that we're in the process of developing. And if any of my colleagues on the Human Rights Committee want to add to that, I'll leave it at that.
Yes, Nili. Neely pointed out that the superintendent from the town of Mamaroneck school system came to a meeting of the Committee on Human Rights and said it's a very political question, which we all know it is. I think there was one more thing he said, which is that we have to lay the political groundwork, and that's what I think we're talking about. Do you want to add to that? Are there any other questions? We're sort of at the end of the time, but I'm willing to stay. Yes.
I'm wondering if the center has a geographic limitations, and if somebody comes from Tarrytown or White Plains, whether they refer us to this analogy organization, or what happens to refer us?
the question was about the geographic limitations of the CRC and whether if someone comes, from example, from Terrytown or White Plains, do we refer out? How do we handle questions from outside of the area?
Yes, so we are county-wide. I think the reality is that we do focus, in large part here in Mamaroneck and Larchmont. We also have clients in New Rochelle. But we find that oftentimes there's special initiatives that take us beyond the immediate locales. So we had a presence in Ossining around some workshops around the Westchester ID last year. We have clients oftentimes in Yonkers where we'll refer. We might have an initial consult here, but we will put them, especially if they need legal services. We have two amazing organizations in Yonkers. We also have legal service partners in White Plains. So we've come a long way from those early years, well before I was here, where we were more of a clearinghouse. But the reality is that we still need to refer in some instances, even just the geographic realities because of the transportation challenges. But rest assured that even in those situations, we don't just do a cold referral. We'll make sure that the individual is getting a response, and if not, then we'll try a different approach. So we try to stay on our toes with that and just be conscious of the reality. I wanted to put Liz on the spot to see if my boss, our board chair, had anything to say.
I wanted to thank Milan for his very, very thoughtful and comprehensive presentation. And I just wanted to mention that with the purchase of our new building last year, and we were very fortunate to do very well at our gala, those expenses, those funds we raised at the gala go towards operating expenses. And with the purchase of the building, this year, very soon, we're going to be initiating a capital campaign drive in the hopes that we can raise the $375,000 to pay off the mortgage that we were forced to take in order to purchase the building and make all of the programs that Milan is talking about a permanent place in our community. So we will be looking for all of you to spread the word and to show up at our events. And as Milan and I take the dog and pony show on the road, hope that we'll see you and hope that you will, as I said, spread the good word. This is a great organization. It does a lot. We couldn't do it without the partnerships that we have in the room. But we do need money. And I was going to ask Milan what's our greatest challenge, just to put him on the spot, but I know what it is. It's fundraising, because we're all competing for the same dollars. They are harder to get, but this is something we really, it's my personal project for 2016. And I thank all of you for being here, and hope I'll see you soon.
I'm going to summarize that one very, very quickly. Although there was one more question, and can I accept the one last question that I saw the hand up? Liz brought up that we have a $375,000 mortgage still on the new center that we bought, and we will be having a capital campaign that we are now engaged in, and that's one of the biggest challenges we face. There was one more question. Do you want to very quickly?
Mine was a comment. Jan Cabello, I'm the immunization director for Westchester County Department of Health. I have worked very closely with school-based centers within the county and find them, as far as immunizations are concerned, because that's my specialty, to be an amazing vehicle to improve access in communities. But they do only cater to school-age children, and we do know that immunizations are something that affects everyone. We need them from birth through the end of our lives, and by providing immunizations, we're not only protecting individuals, but we're protecting communities, and most importantly, vulnerable people within those communities who cannot receive immunizations. So I look forward to working very closely with you so that maybe we can offer some services at your center.
Okay, it was a quick comment, and that will end. I'll summarize it. From the County Government Health Office, I've forgotten your name.
Department of Immunization.
Department of Immunization, Susan, I don't remember the last name. She has said she has worked with open school-based health centers frequently in the past and has found that they do an amazing job, but the problem of immunization is greater than just the school-age population, and she looks forward to collaborating with the CRC in the future. Thanks everybody for coming, and you will find that we have an open door and that Milan is wonderful, exciting, and listens, and it's a lot of fun. Thank you very much, Milan.